Hello everyone, I'm Dr. Srijitra from Examla Healthcare. Today I'm here to talk about one of the most frequently seen disease condition which is treated in our clinic, allergic rhinitis or hay fever or simple allergy. This is one of the most frequently seen disease of today's time. Especially people who lives in cities are affected at least once in their lifetime. So according to recent studies in Bangalore itself, 60 to 65% of the people are affected by this condition. People of all the age group, all the sexes are equally affected, are equally vulnerable to this condition. So if you look into the symptoms, the most prominent symptom is definitely sneezing. Sneezing which might come seasonally or it might come throughout the day, or sometimes mostly it is seen especially in the morning or in the night times. Sneezing, nose block, eye irritation, nose irritation, watery nose, throat irritation, cough, including wheezings. These are the common symptoms that we see along with the allergic rhinitis. But if this disease condition persists for a period of time, then you might get the complications of it, or the secondary symptoms might set in, like polyp development, adenoid development, frequent middle ear infection, frequent sinal infections, especially maxillary and frontal sinal infections, and your sleep disturbances, snoring, sleep apneas. You will open the mouth and you will tend to sleep. So definitely the alignment of the teeth might come a bit off, and frequent fungal infection of the mouth. These are the common symptoms that we can see along with the allergic rhinitis. So although children are more prone to it, people of all the age group and all the genders are equally vulnerable to this condition. So saying that, let me try to answer a few questions that has been frequently asked in my clinic regarding allergic rhinitis. The first being, how does this happen? Well, it happens when your body becomes hypersensitive to some of the inert substance that is present in your environment, like dust, like moisture, like pollens and things like that. If some of these allergic things happens to enter in your body, the body will trigger some immune response which will release the mast cells and it will release the histamine. Histamine is the hormone which will trigger all the allergic symptoms that has been happening to you. So that's how the allergic response happens. And the second question being, why does this happen? Honestly, we don't have a clue. Like most of the diseases, we don't know exactly why these things happen in your body. We can blame it on your gene, we can blame it on the environment, we can blame it on the lifestyles that you're having, but honestly, we don't have a pinpoint answer to that question. So the third question being, why now? So that question is relatively simpler to answer because it is like blowing up a balloon. You can blow the balloon to a certain limit, but beyond that if you try to blow, then it will break apart. The same thing will happen here because if you be in an environment, if you be in an allergic environment for a period of time, the body will react accordingly, and if the irritation persists beyond that period, then it will blow up the immune system, it will blow up the allergic response in your body and will create all the symptoms that you are suffering now. So that is regarding the allergic rhinitis. And the last frequently asked question is, how can we prevent allergic rhinitis? The very simple answer that I can give you is, stay away from all the allergic things, which is an impossible task, especially if you are living in an Indian city. Because staying away from dust, staying away from humidity, staying away from pollen is an impossible task, especially if you are living in an Indian city. So at least what we can try to do is, we can try to wear a mask, especially if you are going out, if you are dusting, if you are cleaning, you can wear a mask. And also stay away from pets, dogs, cats, any feathered animals if you have it at home, pigeons. These things can trigger your allergic response, so stay away from all the pets. And if you are living around a water body, it is not a good place to live in because it will again trigger your allergic response. So you have paid extra for your waterfront Lakeview apartment. I'm so sorry, but it is not good to reside around a water body if you are allergic. How can we treat allergic rhinitis? Usually the conventional way we treat it by giving you antihistamine medications like Avil. According to your intensity and severity, we will decide the dosage of the medication and we will give it. But in a long run, it is not good. It is not a healthy way and it is not a safe way to take the antihistamine medication for a period of time, long period of time. So if you are being affected by this allergic condition in a daily basis, it is also important that you look out for alternative sources to give you a permanent result. Like in homeopathy, where they have a very good medications for allergic rhinitis. They will treat you in a holistic way, because what I have seen in my clinic is, if you are allergic to dust or whatever in your respiratory tract, if you are allergic in your respiratory tract, equally your skin will be sensitive, your GIT tract will be sensitive. Even I have noticed 90% of the time you are mentally also being very sensitive. You will be overly emotional, you will be overly sensitive to all the things that is happening around you mentally as well. So in homeopathy, we will take all the symptoms as a whole and will try to bring down the sensitivity, hypersensitivity towards certain things, rather than relieving your symptom. So it will give you more of a permanent result rather than relieving your symptoms. So you can take out an opportunity, you can look out for a better, healthier way to give you a permanent result through homeopathy as well. So that's regarding the allergic rhinitis. So if you have any doubts or clarifications, you are free to pin me and you're free to comment me. We'll get back to you. So that's regarding the allergic rhinitis, and hope you enjoy the section. Thank you so much.